Alright, today we're going to talk about the treatment of carpal tunnel with acupuncture. So a patient comes in and first thing you want to do is find out where the numbness is. If they tell you there's numbness and tingling in these two fingers, it's probably something different. It's probably more of an ulnar nerve entrapment. What we're looking at is the median nerve, which is these three fingers and half of this one. So to figure out where the neuropathy is coming from, we'll do a couple of tests. The first one is called Tunnel's sign. So what you're going to do is some light tapping over the median nerve, and if that elicits any sort of numbness or tingling in these fingers, that's a positive sign. The other one you can do is Phelan's maneuver, and you just have the patient put the dorsums of their hands together and leave it in a flexed position for 30 to 60 seconds. If that leaves the patient with numbness and tingling, that's also a positive sign. If both of those are negative, then we would move on to some other things further up the chain. It could be coming from the cervical spine or possibly even the pecs impinging the brachial plexus. But for the purpose of this video, we're going to say that both of those signs were positive and have him go ahead and lay down for treatment. Okay, so first thing I'm going to do is put a towel under his wrist, which would help to accentuate the wrist a little bit. What we're going to end up doing is working in an actual tunnel between tendons where the median nerve lies, and we want to make sure that we release all the muscles that are putting tension on that area. Normally, if somebody's very tight through their flexors, a little bit of pressure will cause something like that to happen. You'll see the hand jump up. So we'll know that we'll need to release that muscle. So we'll hit some trigger points in the forearm, and then we'll actually thread through the tunnel itself to reduce inflammation in the nerve. So we'll hit probably 3 or 4 of the forearm muscles, which could be flexor carpi radialis, palmaris longus. Those are going to be our two main offenders, although there could be several contributing factors in this case. And then we're going to do some local needling around the median nerve. Now, if the needle you place in imitates the numbness or tingling, that means that you've struck the median nerve and you want to replace it. So we'll go ahead and place these needles at their proper depth. And let the patient relax for a little while. So that's a basic treatment of carpal tunnel syndrome.